All right, nursing students, first week, second topic. Let's talk about a sterile field. Okay. Once you create a sterile field, you, only you, are responsible to making sure it doesn't get contaminated. Okay. So once it's set up, you want to make sure, excuse me, it's covered. Nobody crosses over it, nobody touches it, nobody bumps up against it. You are responsible for making sure that everything on it is protected so it doesn't get covered. Somebody doesn't spit on it, talk over it, all of that good stuff. It's your responsibility, excuse me, to stop any procedure when there's a break in that sterile field. Any procedure. Um, Traffic movement certainly increases the potential of contamination by spreading microorganisms through the air as people go by it. So if you're setting up that sterile field, you want to set it up just prior to the procedure, not so it's sitting there for 25, 30 minutes so people are passing by. Okay. Um, you don't want to reach over it. You don't ever want to reach over your sterile field. You don't ever want your uniform touching it. You never want anything on that field at all. Okay, anybody that puts their hand on that sterile field will have on a pair of sterile gloves, period. Any object that's on it will be sterile. It is considered in all practice anything below the waist to be unsterile. So that sterile field should be put on a table or a mail stand of something that is above the waist. You don't do it below the bed. You don't do it anywhere below the waist. Anything below the waist is considered contaminated. Just consider that. The outer surface of any sterile field in terms of the package of whatever that you're using, the basically 2.5 centimeters or 1 inch of that border. Usually on the sterile fields in the package, there's a little blue line around the border. That blue line, that blue line into the edge is considered contaminated. So everything that goes on that sterile field starts and goes in the middle. Okay. So those are some basic alerts. Now, gloves aren't necessarily to be picked up. Um, Basically, if you want to put gloves onto the sterile field, they should be gloves that you open up on the outside package. The gloves on the inside package will be sterile. And so essentially, you would want to put those, but you really don't really put gloves onto a sterile field. So they're not necessary to pick up a drape. You can use your clean hand to do that. Um, and you can sort of touch, as I said, the outside borders of the sterile field are considered contaminated, so you can touch the outside borders. I always learned to touch the underneath of the entire sterile field. That way you never had to worry about contaminating anything on top because you're always touching underneath it. But that's a skill you sort of have to develop. Maybe I can show you in another video. A sterile object remains sterile only when touched by another sterile object. So in other words, if there's something on the field, all the things on the field are sterile. If you add something additional to the field, you're taking it out of the package and you're dropping it onto the field. That's the only thing that should touch another sterile object is another sterile object. Okay. If the object falls off the sterile field, contaminated. You open a new package containing the item and add the item to the field. Okay, unless the field itself has been contaminated. Now, if you happen to drop something on the field that shouldn't have been on the field, say the outer packaging, well, you know what? Everything on that field is contaminated. You got to replace everything. So you got to be very careful not to add dirty stuff, contaminated stuff to your sterile field. Very important. Don't flip, throw, toss objects onto your sterile field because they have a tendency to bounce, hit other things, knock them off. It's just bad practice. So we do not do that. Okay, so basically you begin by setting up the sterile field in the work surface. There's a couple of videos that you should watch through your SurePath that should take you through that. When the sterile field has been prepared, you're ready to add all of the items that need to go onto that sterile field. So you want to carefully sort of peel those things open and drop them onto the field. Not toss them, not throw them, and you certainly should never be touching them. Okay, so place the items onto the sterile field, usually at some kind of an angle so they don't bounce or fall off of the tray that they're going onto. They tell you to use your non-dominant hand, but basically as you practice, use whatever becomes more comfortable. So you don't open it towards yourself, you open it towards the field so it drops down just closer to the field so it doesn't have a chance to bounce off. Don't hold your arm over the field, don't cross the field. Remember that, keep in mind, again, that 1-inch border around the field is considered contaminated. So be very careful, but don't rub up against it, rub your uniform against it. The outer wrappers of anything should always be thrown away, not placed onto your field. And anything you take out of the package, once you take it out of the package, if you touch it, it's contaminated, so make sure that you open the package over the field, drop it onto the field, and you should be good to go. Okay, I think that's enough for placing things on a sterile field. Thanks for listening.